For my health presentation, I was given the topic of myasthenia gravis, also known as MG. Myasthenia gravis is a neuromuscular disease characterized by muscle weakness and fatigue. However, this weakness is not caused by atrophy. It is also said to have been caused by other autoimmune disorders such as RA and or lupus. Myasthenia gravis, is a defect in the transmission of acetylcholine due to antibodies that are produced by the thymus gland. And these receptors are known to be decreased in patients with myasthenia gravis. A few risk factors for this condition include any disorder that is associated with the thymus gland, RA, lupus, or even a family history of somebody else having MG, such as your mom or your dad. Some clinical manifestations or signs and symptoms that you may see include a sleepy, mask-like expression of the patient's face, drooping jaw, ptosis, which is a drooping eyelid on one side, decreased breath sounds, difficulty swallowing and chewing, limb weakness, generalized fatigue, but even weak or hoarse voice. A few tests that can be ran to help diagnose MG include chest x-rays, MRIs, CT scans, or anything that may show the presence of the thymoma on the thymus gland. They can also have blood draws that can detect anti-acetylcholine receptor antibodies, and these are present in 80 to 90% of patients with MG. They can also perform the tensilin test, which is a temporary improvement in muscle weakness that can help determine the positive of MG. Other tests include electromyography and repetitive nerve testing for MG. Complications of this disorder include respiratory distress, fatigue, pneumonia, aphasia, aspiration, and even a myasthenic crisis. A myasthenic crisis is an exacerbation of MG, which if it affects the diaphragm, because the diaphragm is a muscle, it leads to respiratory failure to where you will have to be intubated and put on a ventilator. Some interventions that you as the nurse could do to help your patient with MG is monitor their respiratory status and their vital signs frequently. Make sure you have suctioning equipment by the bedside. Monitor speech and swallowing abilities. Encourage your patient to sit up in bed while eating or drinking. And assess their strength or energy levels along with planned periods of rest. Treatments for this, because MG cannot be cured, it is only treated and managed, include medications such as azathioprine and prednisone and any anticholinerase agents. You can also have surgery done to remove the thymus gland, but they haven't said that helps out or anything. Other treatments include IVIG, which is intravenous immunoglobulins, or plasmapheresis. Their overall diet and activity treatment is just as tolerated, but with diet, if swallowing is an issue, you will want to give them thickened liquids, and again, planned periods of rest. In order to interact with the human flourishing aspect for your patient, you want to make sure that any of these treatments or managements is one that your patient is willing to commit to and that they are comfortable with. I'm now going to ask my audience members a couple of questions just to see what they have learned today of my teaching. The first question is, what is a risk factor of myasthenia gravis?
Rheumatoid arthritis.
Thank you. The other question is, what is a complication of myasthenia gravis?
Respiratory distress or failure.
Great, you're correct. All right, this concludes my presentation. Have a good day.
Thank you. Have a good day.